Assalamu alaikum. My name is Dr. Syed Ahmad Bilal Bukhari, and as part of our series of lectures on infections and orthopedic surgery, today we are going to start with skeletal tuberculosis. And in skeletal tuberculosis, the most common uh, area involved is always spinal tuberculosis. So today we are going to discuss Pott's disease or Pott's spine, which is spinal tuberculosis. So, as I have already told you, Pott's disease is a form of tuberculosis that occurs outside the lungs and involves the spine or vertebrae. Spinal tuberculosis always starts outside the spine. It's a secondary infection. It primarily involves or infects any other part of the body, most commonly lungs, or it may also involve large gut or small gut or kidneys or lymph nodes. So primarily those organs are infected, and from those organs through blood or through lymph node, uh, the tuberculosis reaches spine and infects the vertebral column. The most common area of spine involved is dorsal spine, or second most common is lumbar spine, and third most common is dorsal lumbar junction or thoracic spine. So tuberculosis infects the joints of the spine, causing a form of spinal arthritis. And if two contiguous joints become infected, the disc of cartilage, the intervertebral disc, that does not receive the nutrients needed to live, and it starts to be involved in the tuberculosis, and it starts to die, and disease process starts. So here you can see the most common area involved in spine from tuberculosis is intervertebral disc. Two adjacent vertebrae are involved from their intervertebral disc. So the disease of tuberculosis most commonly involves the anterior column, the vertebral bodies. It uh, hardly involves the posterior column, which means the facet joints or spinous processes or transverse processes. It most commonly involves the anterior half of the vertebra, that is vertebral bodies, and in that too, it involves the intervertebral disc. Again, I would repeat, it most commonly involves intervertebral disc. So it is also called, the spinal tuberculosis or Pott's disease is also called discovertebral osteomyelitis. So the disc dies and collapses, leading to a narrowing of vertebrae. Eventually, vertebral column collapses and spinal cord is damaged. And if this process remains untreated, the spinal tuberculosis can lead to severe deformities, most commonly kyphosis, and neurological loss, even paralysis. So here you can see the most common deformity from, from spinal tuberculosis is kyphosis or gibbous. As far as signs and symptoms are concerned, early signs of spinal tuberculosis are as any other part of the body which is involved in the tuberculosis, that is low-grade fever, night sweats, anorexia, weight loss, lethargy, fatigue, and all symptoms which are associated with the tuberculosis. And specifically, as far as spine is concerned, patient will complain of severe backache, and as the disease worsens, the patient also starts to develop such a severe pain which makes it him difficult to even stand or walk or ambulate. So they develop walking difficulty and unyielding postures, and they can also have swelling at the site of infection. As we have already told you that spinal tuberculosis, if it remains untreated, it will form kyphosis. So the early kyphosis appears as a swelling on the back. Patient also may complain of numbness or weakness in the lower limbs. If cervical spine is involved, then weakness in upper limbs. And if dorsal spine, which is most commonly involved, there is weakness in lower limbs. And remember that weakness is always an upper motor neuron type of weakness. And upper motor neuron type of weakness. If dorsal spine is involved, the weakness in lower limbs will be an upper motor neuron lesion, upper motor neuron paralysis. There will be brisk reflexes, there will be hypertonia, there will be uh, upgoing planters. So power may be less or maybe even normal, but upper motor neuron signs will be positive if dorsal spine is involved. So the diagnosis is most commonly the diagnosis starts with a history, which is the tuberculosis, all the symptoms of tuberculosis, low-grade fever, lethargy, night sweats, uh, fatigue, malaise, anorexia, and weight loss, all symptoms of tuberculosis. And in physical examination, you will find localized tenderness at the involved area. There will be a kyphotic deformity, as you can see in this uh, uh, slide. This is gibbous. This is the early uh, kyphotic deformity in the localized area of which is involved. You will patient will feel pain on palpation, that is tenderness. At this point, there will be uh, gibbous, that is kyphotic deformity at the local region, and patient may also have neurological loss or cold abscess. CBC may be normal, but ESR will be elevated. Like in our part of the world, where we do not have diagnostic facilities as widely available and in all parts of the country, ESR would remain an important part of our diagnosis. If a patient has symptoms of tuberculosis, whether pulmonary tuberculosis or renal tuberculosis or uh, spinal tuberculosis or any other part of the tuberculosis, if there are symptoms of tuberculosis, you will also always order ESR, which would be elevated. So it's a sensitive test for tuberculosis, but obviously it's not a specific test. ESR may be due to many other reasons, but in tuberculosis, it is also raised. Motor test was done uh, previously, but now it's not a routine test. The most commonly patients, if presents with the spinal tuberculosis, you will always order first order would be investigation would be an X-ray, and in X-ray you can see on AP view of this area of spine, you see it's a vertebral body here and it's a vertebral body here, but the involved vertebrae is collapsed. The height of involved vertebrae is less than upper and lower vertebra. And when the the tuberculosis starts and the spinal uh, tissues, the vertebrae, they collapse, and the resulting pus will accumulate on the sides of the anteriorly or laterally to the vertebral body. So you will find paraspinal abscess. So this is the shadow of paraspinal abscess. There would be pus uh, around this involved area of tuberculosis. So in AP view, you will find paraspinal abscess and collapsed vertebrae. On lateral X-ray, you can see there is a collapsed vertebra, and which also involves the uh, disc space of adjacent vertebrae, and there is kyphotic deformity, kyphotic, kyphosis, gibbous. MRI is investigation, radiological investigation, which is investigation of choice as far as radiology is concerned. The gold standard or investigation of choice would always be biopsy for tuberculosis, but as far as radiology is concerned, MRI is a superior test, and it will confirm the involvement of disc space and adjacent vertebrae, and it will also confirm the presence of any pus or paravertebral abscess, or it will also show how much compression is there on the spinal cord, how much neurological loss you can assess from MRI. So as disc is involved most commonly, as I have already mentioned you, and tuberculosis is also called discovertebral. As I have already told you, biopsy is the investigation of choice, which can be done through CT, or it can be done through HCN biopsy. If a procedure, if surgery is indicated for any other reason, you will do surgery, you will remove the necrotic dead tissue, which would be sent for histopathology. Management, as it is a tuberculosis, the management always starts with the anti-tuberculous therapy. It is always started there and then. But the difference from other organ tuberculosis uh, is that in spinal tuberculosis or in skeletal tuberculosis, the ATT, anti-tuberculous therapy, is continued usually at least for 12 months to 18 months. आमतौर पे बाकी जितनी भी ट्यूबरक्लोसिस हैं उनकी 89 मंथ्स पे इवन कुछ जगहों पे तो इवन 7 महीनों में 7 मंथ में ख़त्म हो जाती है, लेकिन skeletal tuberculosis की ATT it continues for 12 to 18 months. So as it is TB, तो TB की तो ATT चलेगी, लेकिन एज फार एज स्पाइन इज कंसर्न, स्पाइन का क्या करना है, तो स्पाइन को स्टेबलाइज करना है. अगर तो पेशेंट के सिम्टम्स सीवियर नहीं हैं तो हम उसको कंजर्वेटिव मैनेज कर सकते हैं विद ब्रेस. स्टेबलाइजेशन ऑफ स्पाइन मे बी एक्सटर्नल थ्रू ब्रेसेस और इंटरनल थ्रू सर्जरी. हम एक जैकेट, एक खास किस्म की प्लास्टिक जैकेट बनवा देते हैं, तो जो स्पाइन की अलाइनमेंट को, उसकी पोजीशन को मेंटेन करते हैं टिल एटीटी उसको कर दे. वहाँ पे एटीटी ट्यूबरक्लोसिस को हील कर दे और आपकी उस स्पाइन की अलाइनमेंट मेंटेन रहे, तो पेशेंट बाद में ठीक हो जाएगा. लेकिन अगर उसकी अलाइनमेंट ऑलरेडी डिस्टर्ब्ड है, वो ऑलरेडी उसको काइफोसिस है, या उसको न्यूरोलॉजिकल लॉस है, और या उसकी पेन ब्रेस से भी सेटल नहीं, we will go for surgery. तो सर्जरी की इंडिकेशंस हैं मोर देन 50% ऑफ वर्टिबल बॉडी कोलैप्स, neurological loss, paraspinal abscess, worsening pain और worsening deformity, worsening kyphosis. एंड सर्जरी में हम करते क्या हैं, हम जितने भी ट्यूबरकुलस टिश्यू है उसको ड्रेन करते हैं, उसको रिमूव करते हैं, एक्सरसाइज करते हैं, और जो गैप खपा बन जाता है उस खपे को स्टेबलाइज करते हैं किसी भी चीज़ से. बोन ग्राफ्ट होता है या वट एवर इट इज़, तो हम उसको स्टेबलाइज कर here you can see it's हमने जितना भी टिश्यू था उसको एक्सरसाइज करके यहाँ पे बोन ग्राफ्ट रखा और फिर उसके बाद ऊपर और नीचे स्क्रू से स्टेबलाइज कर दिया। इसी तरह एक सर्वाइकल स्पाइन की ट्यूबरकुलोसिस है, उसको सारा टिश्यू एक्सरसाइज करके बोन ग्राफ्ट रख के उसको एंटीरियर से हमने प्लेट लगा दी, प्लेट से उसको स्टेबलाइज कर दिया। So in short, spinal tuberculosis is the most common uh, skeletal tuberculosis, also known as Pott's disease. So, and it presents with the routine symptoms of tuberculosis plus spinal backache, and that backache may be associated with kyphotic deformity or neurological loss, which will be always upper motor neuron type. ESR will be elevated, and radiographs will show collapse of vertebrae with involved disc. And MRI will confirm the diagnosis, and ADT will be started, which will be continued for 12 to 18 months. And if indications of surgery are confirmed or are fulfilled, then you can always go for surgery.